All right, so you're gonna sign in with your PIV card. If they don't have a PIV card, this isn't gonna work for them yet, so they'll wait until you get a PIV card. And IMED consent will be the same way. You need your PIV card. Oh, so in JLV, you'll get the same patient warnings and flags that you got in CPRS. So you'll just click through those. You've already read them. So close those. JLV is first going to come up with only one tab up here. I've customized mine to how a provider might use it. So providers don't really like JLV and they don't utilize it. I do offer a JLV class if you want to refer them to that You Pick It Leaf training that we talked about in the last AdPack meeting. Um, I find that it is helpful just because you can use this as a read-only screen. So if your providers are flipping back and forth between two CPRS, which a lot of people do, um, you can open JLV in one screen and the chart in the other, and it contains the same information. So if they're writing meds, I have it set up to include outpatient meds, allergies, orders that people have written, things like that. So it has that same information that they would be looking at and flipping through tabs. So this makes things a little bit easier. So what they might be looking for in here are outside records. So in outside records, I have the community health summaries and documents. So if they send their patient out to community care, this is where that information would come back. Where test patients, they don't have these. And then now with more sites going live with Cerner, that documentation won't come back to our chart either. So they need a way to access that, and that would come in here. So the federal EHR slash MHS Genesis, that's where that information is going to come into. So if they've sent their veteran to a place like that, that's where that information will come back. So it is important for people to know how to use that. And especially once our site goes live in about 13 months-ish, this will be the only way for them to access CPRS data. So if we're in Cerner and we don't have CPRS anymore, to get legacy data, they're going to be using JLV. So the sooner people start using it, the better. So one thing to note is that if they change the dates on some of these widgets to like 10 years ago, so if they're looking for records from 10 years in the past and they don't change it back to 3 months, it will load every patient for 10 years. So it's not patient specific, it's widget specific. And if it's trying to load 10 years of data for every patient they open in CPRS, it's going to load very, very slowly and they will hate it. So that's just one trick to make it work a little bit faster, is to reset those widgets if you fiddle around with the date.